Hello, so this is part 4 of joint movement for healthy gait and balance. Now, in the last one we talked more about the hip, and the one prior to that we talked more about the foot. Now we're going to talk about the whole body. How do the arms and shoulders relate to the legs during gait, as well as posture. So we're going to start with actually posture. When we're standing in an anatomical position, we're already in extension. If I move out of that into a sitting position or a squat, that is just about all of my flexors working together. So when I was learning the functions of muscles, I would use this motion a lot, just reinforce, okay, this is flexion of everything. This is also why the ankles get their own names for their movements. Plantar flexion is tied in a bit more technically with flexion because the plantar flexors are on the same side as the flexors of the toe, and the dorsiflexors are on the same side and next to the extensors of the toe. But when I'm standing in gravity and doing this, it actually flips around where I'm dorsiflexing as I flex everything else, and I'm plantar flexing as I'm extending everything. So that's why the ankle movements are their own special thing. But to simplify everything else related to knees, hips, shoulders, elbows, when I go into a seated or squatting position, here are all my flexors, every single flexor, and then every single extensor. If I go past that, then it's all my hyperextensors, right? In this position, I'm essentially already in adduction. If I move out of that in a jumping jack motion, now all my abductors are firing. So adduction, abduction, adduction, abduction. We want to be sure to reinforce for our clients as well as for ourselves that we don't do all of our strengthening only in the sagittal plane, only thinking about flexors and extensors. The classic one for that can be that we're doing nothing but squats and curls. We need to do side laterals. We need to do some kind of rotation things, grabbing an exercise ball, doing some small rotations or a kettlebell, anything. Grabbing doesn't have to be big weights, and maybe that's why people don't do it, because it's a little bit more boring or doesn't look as cool. But grabbing even a couple 10-pound weights and being sure to do some good side laterals, incredibly important. Anyway, related specifically to gait, it's oppositional. Left leg tied in neurologically, predominantly with the right arm, at least when we're speaking about the flexors and extensors, and then vice versa. Right leg with left arm. When I go from standing up, and then I have to switch and start walking, then that's the motion that is occurring. So to exaggerate that, and to reinforce the balance and stability of the non-moving leg, I just lift this leg, about 90 degrees of flexion at the knee, 90 at the knee, 90 at the hip. Same thing at the shoulder, 90 degrees of flexion at the shoulder, 90 degrees of flexion at the elbow. And I just do that back and forth. And now as I come back down, as this leg moves back into extension, so is this arm. So oppositional extensors as well are paired. Now here's where it can get a little confusing. That means that since the opposing flexors are paired and opposing extensors are paired, when we're talking about the same side of the body, it's flipped. So that means that the extensors of my right arm are paired with the flexors of my right leg. And then vice versa. The flexors of my right arm are paired with the extensors of my right leg. That would always hurt my brain a little bit when I was first learning this, okay? So I used to do a lot of remembering, okay, this is paired, and then I keep my arm there, and I go, and this is paired. Or I could say, I start here, keep my arm there, my arm's already in flexion, but this leg's in extension. So the way it ends up looking is this is paired, but then this is paired, this is paired, this is paired, 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 paired. My elbow doesn't want to listen to me. So in practice, when I was testing this with clients, it would be that I'm usually applying force both, for me, it's nearest to their belly or on either side when you get into the gait testing. So if I'm trying to confirm that their flexors are strong from one side of their body to the other, I'm usually applying force here on the anterior side and anterior side, then posterior side, posterior side. If I'm applying force here, I'm checking that these flexors are firing, and then applying pressure here, checking that these flexors are firing. Then if I'm switching that over and testing what's happening on the same side of the body, I'm going to be applying force here on the anterior side of the body, but then here on the posterior side of the body. So confirming that these flexors are firing effectively with these extensors. And then flipping that around, it's going to be posterior side with anterior side to confirm that these extensors are firing with these flexors. So, one more time, just standing, get yourself loose, and then I can even switch and just go same side of the body. It ends up looking exactly the same, but it's a question of what my mindset is. And whatever asymmetry I feel or has been assessed, I then can try to reinforce that facilitation through these movements. So it's everything, at least in practice, I tended to show, and these don't have to be to some crazy end range either. You don't have to be going past 90 degrees at the hips and knees. Optimally, yes, it's good to be able to get to that range, but many of our clients aren't going to be able to. So at the very least that they know all this should be working together. And then it can be even just doing a toe touch. It's a way of helping strengthen and facilitate these connections via the nervous system. And it can be weight loaded. You could be holding weights. You could have ankle weights. You could be using stretchy bands or none at all. These, predominantly for my own care, were used as warm-up routines prior to activity and even cool down post-activity. Regardless, we're reinforcing these paired neurologic groups while also getting some strengthening related to the stability of the leg that we're balancing on, which the more balance, the better. So to go back through all the most important movements I can possibly show you, it comes down to making sure we can move our toes back and forth, flex, extend. We can try to get some abduction, adduction. Really learning to spread those toes out can be incredibly important, beneficial, related to balance. Some eversion, inversion patterns, but specifically, it's easiest for me to show people the dorsiflexion pattern, and easier for you to see if you're assessing this because you can see this regardless of the shoes, right? Getting some strengthening into one range of motion of the big toe extension pattern in particular. All the toes should be able to go into extension, but the big toe in particular. We can reinforce that during massage application, but also it's a matter of one, maybe doing some stretching, but even over the course of time, or if you're already able to get some strengthening while in that big toe extended state. Getting up onto our toes, but remembering that our weight needs to feel like it's predominantly over and onto our big toe, and controlling that deceleration and coming back up into dorsiflexion. And with that hip rotation, which as you can see, I can already relate that and exaggerate that into these gait reflexes. If I include the oppositional arm movement, this is a little bit more natural and trains something closer to a true walking or running gait, as opposed to this more static and robotic movement here. Now, all of these, if done mindfully, can also reinforce good core activation and strengthening in glutes. Biggest one I have for that is this good old Tai Chi stance. Flatten out that low back. Feel your obliques kicking on. Feel your glutes kicking on, especially for massage practitioners. While you're working, think about that. Feel those firing as you're working, particularly if you're applying a lot of pressure, right? So, there you have it. Enjoy, stay safe, read your textbooks.